So when can someone have Medicare and Medicaid at the same time? Now remember, Medicare supplement is not something that you can take or have with the Medicaid. It's not something that would even make sense for people to have together, because Medicaid acts basically as a supplement in this scenario. So how do they interact with each other? Well, a lot of times people on Medicaid live in nursing homes, facilities, so they're in that scenario, and they also have Medicare as their health insurance. So that's one scenario where it happens quite a bit. And others are for people who are just low income and still living, but on Medicare. They can qualify for Medicare and Medicaid. Medicare pays first, and then Medicaid pays second. That's essentially, Medicaid is the replacement for Medicare supplement in this sense. So this is where you would see this most often with someone who was on original Medicare but qualified, and then they don't end up being on original Medicare. They will typically go to dual eligible plans. You will see on more so on Advantage plans. You'll see them as SNPs, special needs plans. So people who qualify for that get both, and Medicare pays first and then the Medicaid pays second. There's a couple definitions that people are qualified as and how much coverage they will get through Medicaid. So the first one's a qualified medical beneficiary, otherwise known as a QMB. So with those people on that program, everything's covered, all the premiums for Medicare and then any medical bills that come with it, co-insurance, deductibles, all that stuff paid for. Now there's another one called the Specified Low Income Medicare Beneficiary. There's SLMB. Those individuals on that program, they get some of their Part B premiums covered, and same as the people on the Qualifying Individual Program, the QI, they get part of their Part B premiums covered, right? So those are some special needs plans and people that qualify. Big thing to do when you're getting into Medicare, especially if you're just doing it, or maybe you feel as though you qualify, is to definitely go fill out a form on the website. I'll put the link in here even for those of you that want to do it. Go check out the website and apply and see if you qualify for it, because if so, you could be getting at least part of your Part B covered, if not everything covered, just depending. So, or if you have a loved one who you think could use this plan that doesn't have it already, definitely look into it. Like I said, I'll put the link in the video so that you can check it out. Also have a link to my website and a link to my Medicareful site that'll show some of the plans available in the area. Like this video, subscribe to my channel, and I'm gonna keep putting out some more of this relevant content for you guys to understand these basic functions of our very complex healthcare system here in the United States for the senior citizens, and continue to provide insight and try and make these much simpler to understand. Try and make these things that are very confusing at times very simple to understand. It's not always the easiest. So in very, very short man's terms, Medicare and Medicare supplement. Medicare supplement for people on original Medicare. Medicare and Medicaid is Medicare Advantage and Medicaid. And Medicare covers first, Medicaid covers like a Medicare supplement. And it's government paid as opposed to someone paying for it privately. You have to qualify for it through proof of income. Hope this was helpful. I wanted it to be very, very clear and concise what goes with what. Medicare original with Medicare supplement, Medicare Advantage with Medicaid. So with that being said, I hope you guys have a great rest of your day, and I look forward to seeing you guys tomorrow.